Hey future nurses and nursing students. Welcome back to our NLE and practice question series. Today, we're diving into a community health nursing scenario that tests your critical thinking and prioritization skills. Ready? Let's get started. Here's the situation. Nurse Sandra is a school nurse planning her home visits. She has a list of students she needs to check on, but she can only visit one today. Who should she prioritize? Let's meet the students. First, we have Pedro. He's 9 years old and his parents both work full-time. Next is Melissa. She's 10 years old and has been noted to have stunted growth for her age. Then there's Cindy, who is 7 years old. She's been absent from school because of some skin lesions. And finally, we have Mike. He's 8 years old and his teachers have noticed he often falls asleep during class. So, we have 4 options. A. Pedro, the 9-year-old with working parents. B. Melissa, the 10-year-old with stunted growth. C. Cindy, the 7-year-old who is absent due to skin lesions. D. Mike, the 8-year-old who sleeps in class. Take a moment to think. Who is the absolute priority for Nurse Sandra to visit today? Pause the video if you need to, and drop your answer in the comments below. Alright, have you got your answer? Let's break it down together, using our nursing knowledge. When we're talking about prioritization, we often think about what's acute versus what's chronic, and what poses the most immediate risk. Let's look at each case. Pedro's situation, having 2 working parents, might suggest a potential for being a latchkey kid, but it doesn't present an immediate health crisis. It's a social factor worth noting, but not an urgent priority for a home visit today. Melissa's stunted growth is a significant concern. It could point to nutritional deficiencies or an underlying chronic condition. This definitely requires follow-up, but it's a long-term issue, not an acute one that needs an immediate visit over others. Mike sleeping in class is also a red flag. It could be due to lack of sleep at home, poor nutrition, or other issues. It's important, but again, we need to compare its urgency to our last option. Now let's look at Cindy. She is 7 years old, absent from school, and the reason is skin lesions. This is the key. Skin lesions can be a sign of a communicable or contagious disease. Think about things like scabies, impetigo, or even chickenpox. If it's contagious, it not only affects Cindy, but also poses a public health risk to her classmates and the entire school community. Therefore, the correct answer is C. Cindy is the priority. Nurse Sandra needs to assess Cindy's skin lesions immediately to determine if they are from a communicable disease. This allows for prompt treatment for Cindy and helps prevent a potential outbreak at the school. It addresses an acute problem with a potential public health impact. How did you do? Let me know in the comments. Understanding prioritization is key to being a safe and effective nurse. If you found this helpful, give this video a thumbs up and don't forget to subscribe for more practice questions and nursing tips. Thanks for watching, and I'll see you in the next video.